I'd like to start this webinar by acknowledging that I'm on land of Indigenous people, the Ngunnawal people, Aboriginal people of this area, and I pay my respect to their elders past and present. I would like now to begin the webinar, and I'd like to begin by also thanking Alexandra Jones, who's not one of our speakers, but who has been instrumental in helping us put the webinar together, and it's greatly appreciated the effort that she made. In this webinar, we will do a couple of things. The first one is have a disclaimer declaration of conflicts of interest that you can read on the screen, that was on the screen a moment ago. The objectives of the seminar are to facilitate knowledge sharing and collaboration, to engage professionals from different fields, to provide new, innovative and applicable ideas, to enhance relationship building, and to develop community health systems, because when we are talking about front of pack labelling, we are talking about public health systems. We also want to create guidelines to combat unhealthy diets and NCDs. Do keep in mind that none of us see the front of pack labelling as the answer to any of our health problems. It's a small part of a much wider issue in terms of nutrition and diet. In today's webinar, we are going to start with Lorena Rodrigo-Oziak from Chile, who'll talk about food warning labels and regulation in Chile, followed by Mike Rayner in Britain, who'll talk about the traffic light system, Mary Lab from Canada, who'll talk about the mandatory FOPL policies, front of pack labelling policies there, Chantal Julia from France, who will talk about the Nutri-Score system, and Cleona Nimershi from New Zealand, who will provide the Australia-New Zealand Health Star system perspective, and then Rebecca Bousted from Kellogg's in Australia, who will talk about industry engagement. We'll follow that with a discussion, and for those who are attending the webinar, there is the opportunity to chat online, to put questions online. We will also run a poll in the process. And I do need to thank our sponsors, which includes the Australian Health and New Zealand Health Star Rating, Kellogg's, Sanitarium, and the University of Geneva. I also draw your attention to the hashtags that we have for those who are tweeting. I think my preferred one is the front of pack labelling, FOPL, but there's reasons why others might use other ones, and that's fine. The context here, of course, for us is the Sustainable Development Goals, because it's not just Sustainable Development Goal 3, as this is how it's presented by the World Health Organization, but look at no poverty, look at hunger. There are many Sustainable Development Goals that impact on health and that have an impact here. And also within the way we see public health, which is broadly defined in our global charter for the public's health, that takes protection, prevention and health promotion, and then has 4 enablers: good governance, accurate information. We say accurate information since Donald Trump, capacity building, and advocacy. And we always see these as being read together. And here, the Global Charter for the Public Health has been used as part of the framing a call to action on the front of pack nutrition labels, and our speakers have agreed to the call to action, which will be circulated as part of this webinar and coming out of this webinar. And I mentioned those basics and then the enablers. So in terms of the front of pack labelling concepts that underpin different systems, there actually still no definitive agreement on what those systems should be. What we really need is a clear and simple and interpretive system that's made of symbols and colours. That's generally, I think, all are agreed on that. And what we're trying to do, of course, is make healthier choices the easier choices. And I think one of the most important things, and one of the things we're still working on, as Cleona will identify and others, that making systems that are nutrient-based but as consistent as possible with dietary guidelines can be quite challenging. And I suppose that means that we also understand that it doesn't matter what our system is, it's never going to be perfect. We're trying to get the best we possibly can. And many of us believe that they should be mandatory, and certainly those in public health. So for this webinar, though, I think we should be conscious that there's 20-odd countries with different systems. We are trying to see international coordination, and it's interesting that Codex, the Food and Agricultural Organization, United Nations, are attempting to get some agreement on principles, but each government still seems at the moment to rely on different principles. There is work being done on this, and certainly a committee within Codex chaired by Costa Rica and co-chaired by New Zealand is looking at it. But we also have to keep in mind that Codex has a dual role. It's not only there to promote consumer health, but it's also there to promote fair trade practices as part of its role within the World Trade Organization. So sometimes we have concerns about disproportionate representation by food industry within Codex. And it is interesting that in some of those countries, 5 countries who do have mandatory proposals, concerns have been raised already at the World Trade Organization. We hope that those concerns will be overridden and that health will take priority, but that is an issue for us. And it's also important for us to, in this webinar, to talk about and understand the role of industry, which is why, of course, we have invited Rebecca Bousted from Kellogg's to join us. And I think, finally, I'd like to say that it is a public health webinar organised by the World Federation of Public Health Associations. And for us, the priority of public health in all decision-making regarding improving diet has to remain as a priority. And I can't help myself because I am with the World Federation of Public Health Associations. I am going to advertise our Congress, so you can start planning for the World Congress in Rome in 2020. With that introduction, I'd now like to invite Lorena from Chile to share with us.
Yes, thank you very much for the invitation. Good afternoon from Chile. Here is 4 o'clock. And first of all, I want to show you some slides about our situation. You can see that over 70% of our population are obese or overweight. And this is the same thing in children, where we have more than 10% obese and more than 30% with overweight. Then you can see only like samples the very bad situation that we have in Chile. Then we define the approach and the model to act tackling obesity, and we decided to act from food environments with social determinants, considering social determinants, with health in all policies, of course, because it's not only a problem for health, and mainly with structural strategies like regulations, law, or something like that. You can see in this slide that we define our own food environment, and we act to modify food environment to tackle obesity. First of all, we define food and nutrition national policy to bring the context to develop different strategies. projects, programs, plans, or laws. And we define that social determinants are very important if we really want to change our situation. Okay, about our new or relative new law, I will show you about this. This law has two main goals. First of all, children protection, but also modify food environment by three big areas. Restriction marketing, especially children food marketing, restrictions on sales of foods in schools, and the issue of this meeting front of package warning label. We hope to modify children exposure to marketing and to modify especially school environment. For the implementation of this food law, we previously have mandatory nutrition labeling since 2006, and we have health and nutritional claims before 2006, and we have strict limits of trans fatty acid contents since 2009. About warning front of package labeling and for the law at all, we define first which critical nutrients are the scope, and we define sugars, saturated fatty acids, sodium, and energy because of scientific evidence. Then we define cutoff values by 100 grams or 100 ml. We develop a group of experts that work in this cutoff values. And then we define the scope of the law, and we define that only added foods are going to be by the law. But we excluded natural products because to stay in according to dietary guidelines. We defined then ingredients that add critical nutrients, and we made a list of ingredients that added sugar, saturated fatty acids, and sodium. Then we developed studies to evaluate different logos and warning phrases, and we prove this, we test this with our population, different colors, different phrases, and different logos. And finally, we define this black octagon-like stop traffic signal with white letters. Then we chose a warning phrase, and high in seems to be the most easy comprehensive for our population. And high in calories, sugar, saturated fatty acid, or sodium. These are the list of critical nutrients with cutoff values. You can see that we have 3 steps because we talk with different stakeholders from the industry, from academic, and different stakeholders of the government too, and they ask us about the possibility to make a graduate implementation of the law. Then we define these 3 steps, and now we are in the second step. Something about the evaluation on December last year, and you can see that we control this law and we made many inspections, and most of them compliance with the law, more than 70%. When we ask to the population about logo recognition, they say yes, more than 90%. We ask also about if the people compare the logos in the moment to buy foods, and something like half of them, 50%, said yes, they compare. And if the presence of logos in food affects their decision, they say yes, nearly to 80%. We think that these are very good results only with 1 year of implementation. We ask also for the industry about their reformulation, and they say that similar, near to 20%, they have reformulation, mainly in beverage, also in dairy products, and in cereals. You asked me about pluses and minuses, and I can say that the mainly plus is the logo is very easy to understand for our population. I don't know what happened in other countries, but in Chile, our population didn't understand traffic light, for example, with 3 colors. They were very confused with 3 colors. They prefer 1 color, and we prove different colors. And finally, black is the most easier way to understand in little seconds, in very few seconds, to decide if they can buy or not this food. And it's easy to distinguish of other image on the package, because package is very colors and many pictures, then how to distinguish in front of package. And black is the most sensitive for our population. So we think and we prove and we test that it is really an age to decide, to best decide, to best choose. And minuses, I put it there that the logo is very innovative. And I say that because in the first steps, mainly in the first steps of the process, some sectors didn't like it because they say that no one have these logos and it's very afraid for people. And I think that the innovation, it's not very easy to do when you are making a law to protect our population. Always we think that protect health is the first purpose of our law. We say in Chile, prefer foods with fewer logos, and if they do not have, it's better. Thank you very much for your attention.
Thanks, Lorena, and for those participants. Lorena is going to have to leave us in a short while, so we'll probably not be able to answer any questions. However, we will seek to ensure that any of your questions are covered. I'd like now to invite Mike Rayner from the United Kingdom to talk about the front of pack traffic light system used in the UK and to give a broad overview. Thanks, Mike.
Okay, thank you for inviting me to talk about traffic light labelling in the UK. In my presentation, I'm going to start by talking about what we actually mean by front of pack labelling. Secondly, to think and talk about traffic light labelling in general, then traffic light labelling in the UK, and then to describe some strengths and weaknesses of the UK traffic light labelling scheme and make some suggestions about how it might be improved. So I think traffic light labelling front of pack labelling can be classified into 6 types. Firstly, there's a supplementary interpretive labelling, interpretive nutrition labelling, which divides into nutrition-specific systems and summary indicator systems. In the first type of nutrient-specific systems, we have things like traffic light labelling, and with summary indicator systems, we have schemes like the Health Star rating system and the Nutri-Score system in France. And these, in my view, are the true types of front of pack nutrition labelling. Then we have 4 types of front of pack labeling, which can be called health and nutrition claims or health warnings. So at the top you have health and nutrition claims, which are simple, and they can be just for nutrients and they keep the nutrients separate, or they can summarize the overall nutritional quality of the food and give you an overall indication of the healthiness of its healthiness. In that category, we have things like the Keyhole Choices International logo and TICS logos from heart foundations. And the last two types of front of pack labeling are the warnings, health and nutrition warnings. And we just heard about the Chilean health warning system. That's a nutrient specific system which keeps the nutrients separate, but you could in theory have an overall warning for the healthiness of the food. You could in fact have a red keyhole to complement the green keyhole. But these four types of front of pack labeling on this slide, I think, are not true types of nutritional labeling. I think it's very important to bear in mind two aspects to simplified front of pack labeling in general and traffic light labeling or any other form of labeling. And that's the design and the format. Firstly, the design and the format of the label, and secondly, the underlying nutritional criteria, the nutrient profiling model. They should not be muddled together, and they're very different. So let's turn now to traffic light labeling systems around the world. I think it hasn't spread very far beyond the UK. In the UK, it began or was introduced in 2006 by the then UK Food Standards Agency. And other retailers following suit. And then we have the Ecuadorian traffic light labeling, the Iranian traffic light labeling, and a new industry devised traffic light labeling scheme called the Evolved Nutrition Labeling System. And these four types of traffic light labeling actually involve different nutrients and different reference amounts for the underlying nutrient profiling model. So when designing or devising a new form of front of pack labeling, I think you have to address a series of questions. Firstly, about the nutrient profiling model, and secondly, about the design. And this is what we did in the UK when devising the UK traffic light labeling system, and it took several years to come up with a good system. So firstly, I think you need to decide whether you're going to put the labeling on all foods or just some categories of foods. Whether the thresholds need to be the same or different for different categories. Generally, people have different thresholds for foods and drinks. You need to think about which nutrients you're going to involve, what the reference amounts for those thresholds should be, whether they should be per 100 grams or per serving. And finally, you need to really decide how strict you want the thresholds need to be. So in the case of traffic light labeling, how many reds there are going to be on foods relative to greens. And secondly, turning to design, there are various aspects to the design of the traffic light labeling which need to be considered, particularly whether to supplement the colors with things like words like high, medium or low, or numbers. So here's the UK traffic light labeling scheme. Firstly, the underlying nutrient profiling model. All foods are judged on the same basis and all drinks are considered separately. The green amber thresholds are set at the levels for low in European legislation on claims, and the amber red thresholds are set at 25% of the reference intakes per 100 grams and per serving. You could say a lot about the nutrient profiling criteria and how we arrived at the precise numbers. And then secondly, here's the design of that UK traffic light labeling scheme, of the UK traffic light labeling scheme. This design is limited to some degree by the 2011 European legislation on food information. So for example, we have to have in our labeling scheme fat rather than saturates, sugars and salt and energy as well. We couldn't have any other nutrients such as fiber or whatever. The guidelines in the UK for this format were drawn up by industry, but in collaboration with the government. There has been a lot of research carried out into traffic light labeling in the UK and elsewhere, both in the design and in the underlying into the underlying nutrient profile model. There have, in the course of developing the model, been lots of studies, again, carried out by the UK Food Standards Agency into the preferences of consumers. Consumers generally like traffic light labelling compared with other forms of labelling available at the time, at least. And there have been some performative studies, i.e. testing exactly whether traffic light labelling helps consumers make choices between healthy and unhealthy foods. But those studies were generally done in labs or online. There have, again, also been some research carried out once the scheme was developed, and particularly some research by my group into looking at how the introduction of the traffic light labelling affected consumers' food purchases. And I should say, in general, the results have been disappointing, that it's been difficult to demonstrate an effect of the introduction of traffic light labelling in the UK on consumer purchases. And it's also said, of course, the labelling scheme has had an impact upon producer behaviour in getting them to reformulate their products to avoid reds. But again, most of that evidence is anecdotal. There has also been a little bit of research into the nutrient profiling model itself. So a scheme, for example, can be quite effective in getting people to change their behaviour, but unless the underlying nutrient criteria are good for health, if you like, it's not going to be useful in the end of the day for health. So some strengths and weaknesses, pluses and minuses of the UK traffic light labelling scheme. I think it's better than a lot of than nutrient-specific schemes that are not colour-coded, such as the industry-developed percent GDA scheme, but it's not as good, in my view, as colour-coded summary indicator systems, such as the Nutri-Score, which we're going to hear about later. Consumers can choose the nutrient they want to focus on because the nutrients are kept separate, but that means the scheme doesn't really give you an overall indication of the healthiness of the foods. It's quite simple, but I also think it's too simple, that it doesn't include within it levels of beneficial nutrients. It's just a warning system, if you like, against high levels of unhealthy nutrients. So how would I improve it? I think there's lots of ways the UK traffic light labelling scheme could be improved. One would be to add an extra category for fats and oils with different thresholds, to make it a 3-category scheme, such as the FSAN's, Food Standards Agency, Australia, New Zealand, nutrient profiling scoring criteria. I would lose the light for total fat. I think there's increasing evidence that it's the balance of types of fat in the diet that matters, not the overall fat intake. I would swap the light for total sugars for one of free sugars. We cannot do that at the moment because constrained by EU legislation, but come Brexit, we'll be able to do that. We can set all the thresholds on a per 100 gram basis than a per serving basis, and I think we could go into that in the discussion. And I would drop the reference intake per serving information and also make the red amber threshold stricter. So these are my ways of improving the model. Just to summarize about those 6 types of front of pack labeling systems I showed you earlier, I think this slide tries to argue the point that just having a good impact on consumer purchasing behavior doesn't necessarily mean that it has a good impact on health, and we need to separate those two. So, for example, I think the warnings systems that has just been described from Chile, undoubtedly from other pieces of research, not just carried out in Chile, has an important impact on consumer purchasing behavior. But because it doesn't give you an overall indication of the healthiness of healthy foods, for example, I think its impact on health is limited. And this slide shows that I think the best available system at the moment is something like a summary indicator system as implemented in France, the Nutri-Score system, which has both quite a good impact on consumer purchasing behavior, but a better impact on health than some of the schemes. So that I'd like to stop. Thank you very much.
Thanks very much, Mike. It's not only a good looking at traffic lights, but also a good understanding overview. I'd now like to go to Mary Lab from Canada and invite Mary to talk about the system there and particularly the mandatory nature.
Okay, well, thank you all, and greetings from Canada. So I'm going to talk about our front of pack labeling system in Canada. It's part of the healthy eating strategy introduced by the governments of Canada. And just to explain, we're at the phases right now of being at Canada Gazette Part 1. In other words, the regulations were published last February, but they are not finalized until the final regulations are published within 18 months of that date. So we expect the final versions of the regulations to be out in either late 2018 or into 2019. So my next couple of slides are going to talk about why front of pack labeling matters. And what we're really doing in attempting with front of pack labeling is to not just provide consumers with the facts, but also provide them with the information and able to interpret that information. And I've shown some of the various front of pack labeling schemes that I think are all add much more interpretation for the consumer to understand and use the information provided on the various facts-based or nutrition facts tables. And why you go to more symbol-based or interpretive-based labeling, it really reduces the cognitive skills required by the consumer to actually use that information. And the other thing that front of pack labeling does is it really does balance what I call all the other information that is on food packages that are really just promoting the positive attributes of the food. And for consumers, that really can give what we call a halo effect. And this is data from our research group that really shows that right now about 50% of foods in the Canadian food supply carry some form of claims on the front, and about 20% already have front of pack symbols, but all of these refer to positive attributes of the food. And what do I mean by this halo effect? This was another study done looking at a food, I think it was a chicken dinner. And you can see in the light blue over on this side, this is just the nutrition facts table. But when a food has a health check showing it's healthier, the consumer thinks it's healthier, even though that's the exact same food with the same nutrition facts table. Similarly, when there are specific systems or traffic light labels, while just the guideline daily amount, which just gives nutrient levels, performs similarly to the, in terms of the eye of consumer being healthy as the nutrition facts table. Equally, we get that same effect with the foods that have health claims. And I said about 50% of the foods have health or nutrition claims. And if you look at the first bar as in terms of how the consumer consider this happens to be a soup can, a tomato soup, when the food has a nutrient content claim or a health claim, consumers perceive the food as being healthier, even though it has exactly the same nutrition information, and in turn would be more likely to purchase that food. And the final reason of why simplified nutrition front of pack labeling is important is that halo effect is actually higher and more magnified in consumers with lower health literacy. And this was a study of a whole variety of juices and beverages that had a variety of labels on, and a variety from unhealthy to healthier beverages. And you can see that consumers that had lower health literacy perceived those foods, no matter what the nutrition levels were, to being healthier than those consumers who had adequate health literacy. So the next, that was a good setup of why. The next couple of slides, I'm going to talk to you about what the actual proposed system looks like in Canada. So the regulations that have been proposed were that it will be a mandatory system. Unlike the traffic light labeling, it will be mandatory. All foods that exceed the thresholds will have to put the front of pack warning type label on foods. Although at this point, with the last publication in Canada Gazette Part 1, we do not know what the actual label symbol will look like, but it will have elements similar to what we see here, but the final version we don't know. The symbol will be based on thresholds for 3 nutrients of public health concern, and they include saturated fats, sugars, and sodium. And there will be some exemptions for foods consistent with the food guide, and in the regulations, there are specific regulations that will govern the format of the front of pack system and how it fits on the food package. I'll describe that next. And to also let you know, although these regulations were published in 2018, government has announced that they will not come into full force until the end of 2022. In other words, 5 years after the intention was first published. Oops, sorry. And so now I'm just going to briefly overview. Mike had said the UK system was based on a 25% threshold. In Canada, the Health Canada is proposing that the thresholds would be based on foods that exceed 15% of the daily value, and it would be 30% for packaged meals or main dishes. And this is consistent with the labeling education program that has been set up in Canada and has been operating for a number of years, where Canadian consumers have been taught to use this daily value symbol, where 5% represents a little and foods that exceed 15% are considered a lot of a nutrient. So the front of pack labeling will also be consistent with our nutrition labeling education campaign as well. I mentioned there will be some exemptions. So in other words, foods that are already exempted from carrying a nutrition facts table, for example, unprocessed vegetables and fruits or meats, will be exempted from the front of pack labels, as will restaurant foods. Unfortunately, they don't have nutrition facts tables, so as the legislation currently sits, they will not be required to have front of pack logos on the restaurant menu boards or in menus. Foods that have no added saturated fats, sugars, or sodium would also be exempted from producing or carrying a front of pack label, as would foods where the symbol was considered redundant, i.e. packs of sugars or packs of salt. There's a number of clarifications or very clear specifications in the regulations about formatting. So the size of the format is based on the principal, the size of the label must be, front of pack is based on the principal display surface. In other words, it must appear on the top 25% of the principal display surface or the front of the package. There can be no other nutrition information in a buffer zone. In other words, the top 35% cannot have any competing health-related names, logos, symbols, or seal of approvals or other marks in that top 35% of the package. And additionally, the size of any other health-related symbols or claims on the package cannot be larger than 2 times the size of the capital letters in the front of pack symbol. In other words, so they cannot overwhelm and really have the front of pack symbol lost amongst the other information on the food package. And we have a food label program that has looked at the foods that are sold in the Canadian grocery stores. And one of my postdocs, Anthea Christoforou, has looked at the proportion of foods from our food label database that would be required to carry a front of pack labels if they were not reformulated, and by what they looked at in 2013. And you can see that about 28% would be over the threshold for saturated fats, about the same amount for sugar, and about 35% would exceed the thresholds for sodium. And that would result with about 67% of foods, if they were not reformulated, would carry at least one front of pack symbol in Canada. And this, of course, would vary by food group, as not all food categories are somewhere much more healthy than others. So obviously you wouldn't see as many front of pack symbols in all the food categories. And I just would like to finalize by just saying what we see this system doing is really moving the responsibility for making healthier food choices from what were just simple education programs that put all the onus on the consumer to find and make healthier food choices, to things like regulations where you mandate nutrition facts tables on food packages. We have mandated calorie labeling in some restaurants in Ontario, one province, and now, of course, this mandated front of pack labeling system. But I think we also see that we can even go further with other regulations that are currently being introduced in Canada. We really do put regulations to improve the food environment, and I would give examples like this for setting the limits for sodium in foods, which we have benchmarks in Canada now, and the most recent ban on the use of industrial produced trans fats in foods in Canada. And with that, I'd like to thank you all very much, and also acknowledge the funders and many students and collaborators who we've worked with over the years in this area. Thank you.
Thanks very much, Mary. There was just one question that came in that I think is worth answering now before I go to Chantal Julia, and that is, are cheeses included in the system?
Yes, cheeses are. Now, how they'll work out in the final thresholds and cutoffs, there is still some work being done, and because we're in phase 1 of the Canada Gazette, there may be some adaptations to ensure consistency with Canada's food guide, but as it is now, there are a number of cheeses that would have either, for example, sodium front of pack labels in some of the cheeses.
Thanks very much, Mary, and thanks. Sorry, here I go again. Can I please ask you to close your screen, and then I can go to Chantal Julia. Thanks very much.